Strike Stroke. My name is Dr. Mekdes. I'm a third-year neurology resident, and my passion is to learn neurology and teach you what I know, most specifically in regards to stroke, so that you would be well knowledgeable to recognize the signs and symptoms of stroke and be able to activate the emergency medical services in time to help yourself, your loved ones, or someone near you. Today, I would like to talk to you about gaze deviation. So gaze deviation means that our eyes are not midline and they have deviated to one side, either the left side or the right side. The eyes are yoked together. That means they work together and they move one side to another together. The part of the brain that keeps our eyes midline is called the frontal eye field, and they're located on each side of the frontal lobe. You have a left frontal eye field and a right frontal eye field, and they work together. They're always on, so they have a tonic phase. Because they're both on, they keep your eyes midline. The frontal eye field, in addition to keeping your eyes midline, are in control of saccade. So saccade means that you're able to look from one point to another very quickly. For example, if I want to look at this finger and this finger quickly, I saccaded. Let's say you're in a doctor's office and they tell you, follow my finger with your eyes only. You're pursuing their finger. That is called pursuit, and that is controlled in the parietal lobe gaze center. Both the frontal eye fields and the parietal lobes, which controls pursuit, control lateral gaze, or your eyes moving from left to right. So the control is opposite, meaning that the left frontal eye field, when they fire, help you look to the right, and the right frontal eye field, when they fire, help you look to the left. So for instance, let's say an individual has a left middle cerebral artery ischemic stroke that affected the left frontal eye field. Because this is a destructive lesion, it will turn off the left frontal eye field. In this case, the right frontal eye field is on and it's unopposed. Therefore, it will push the eyes to the left. Therefore, this individual will have a left gaze deviation. Gaze deviation is one of cortical sign, which means a stroke has affected the cortex, which is the very top portion of the brain. And we talked about what cortical sign means in the prior episode when we compared primary versus comprehensive stroke center. We see cortical signs when an individual is having a large vessel occlusive stroke. In that episode, we also talked about what are called large vessel arteries. So during stroke analysis, we look at gaze deviation, aphasia, neglect as a sign of cortical sign, because in addition to giving TPA, we can also do mechanical thrombectomy to remove the clot out of these large vessels. So if you notice someone near you is having difficulty communicating, or the eyes are not midline, move to one side, or they don't recognize one part of their body, they are having a cortical stroke, and you should activate the emergency medical services by dialing 911. So in summary, today we talked about gaze deviation, which means our eyes have moved to one side and are stuck there. And we said this happens because of stroke being a destructive lesion, and it affected the frontal eye field, which is located in the frontal lobe on each side. When the frontal eye field is down one side, the other side will overpower the one that's not working, and the eyes would move to the side of the lesion. So in stroke, we say the person is looking at the lesion. And gaze deviation is a sign of a cortical stroke. We call this cortical sign. This happens when a person has a large vessel occlusion. If you recognize these symptoms, call 911 so that the person could receive rapid stroke analysis and tailored treatment. Thank you for watching. I hope you found this information useful, and always remember to dial 911 if you or someone near you suddenly can't see, can't speak, can't walk, or can't feel. Let the operator know that you or someone near you might be having a stroke, so that you or the individual near you can be transported to the nearby comprehensive or primary stroke center for rapid stroke analysis and tailored treatment.